everyone. We're Team 8, Robert Smith and West Consulting. I'm Victoria Roberts. This is Angela Smith and Jeffrey West. You gotta come in the picture. Our initial 7 that we wanted in task 1, we kept 4 of those. We were able to keep family pathways, and we also were able to add the student pathways. That was really important to us. We kind of focused on improving everyone's quality of life with the improvement health behaviors and self-care and coordinating care. So that was really important to us. And we also were able to get both of the funding options in there. For Contingent Global Payment Scheme, we focused on Medicaid and Medicare and offered those at 100% funding, and then just did 35% funding on the commercial insurance.
Okay, so our overall package, this is kind of an example of how it rated on several different areas. And we had a couple of key things that we were looking at as we looked at which initiatives to include. As Courtney said, we were interested in initiatives that improved quality of life in the long term, initiatives that allowed people to, in some ways, to manage their own health and to have healthier outcomes long term. So that's why we kind of focused on things like the 2 Pathways programs. We were also very interested in mitigating inequity and the impacts that that could have on health of the overall population. And funding. Sustainable funding was also very important to us. And we knew that that initial fund was very, very good for getting things off the ground, but that we would need ways to fund the initiatives over the long term. So we're just going to look at how the strategy worked on each of the 5 different criteria. So initially looking at healthcare costs, we were able to lower per capita costs by approximately $1,000 per capita over the long term, and there's a steady trending decline. So it was a sustainable decline over time. Looking at quality of care. That's something that we felt was very important, but we tried a couple of different options to impact it, and we found that this package worked together to increase quality of care through coordinating self-care and or coordinating care across providers and through emphasizing self-care. We were able to decrease hospital readmissions by 21% in the first 5 years, and increase adequate care by 33% in the 5 years. So we felt that it was important that these were very quick outcomes and sustainable in the long term. Productivity was actually we had a huge impact on productivity with this strategy, and we felt like that was really important for the region as a whole. We were able to increase per capita over the baseline as almost $3,000 in the long term, and the overall increase for the region was approximately $1 billion over the long term. So we just felt that it was really important that healthier population leads to a more productive workforce and therefore greater economic benefit for the entire region. And looking at population health, overall population health, this was impacted by, I think, the entire package of initiatives, and especially how they interacted together. So the Pathways programs, focusing on both students and families, increased economic advantage and decreased disadvantage, and was able to therefore lead to healthier population overall. So we saw a 21.5% decrease in severe chronic illnesses, and we were actually able to have high-risk behaviors by 2040. And another interesting outcome was untreated mental illness declined by 26%, which was a positive externality to our program because none of our initiatives were designed to directly impact mental illness, but they had this extra effect that we didn't even anticipate, but that has a great impact on population health in the long term. And finally, inequity was something that we felt was very important. And we were able to decrease the disadvantaged fraction of the population. It was projected by the baseline to be at about a third of the population by 2040, and with implementing this package, this strategy, we decreased it to about a quarter by 2040, and decreased deaths from disadvantage by 37% over the long term as well. And again, these were sustainable impacts that you can see the trend continues to decline over time.
And so initially we had a couple of shortfalls. One of the pitfalls was funding shortfalls, which led us to use both funding options. We also used staggering the start dates of different initiatives, and this helped put the more expensive upfront costs after we had already accumulated some of the money. And this ensures adequate and sustained funding. Our first few runs was very poor because they ran out of money so fast, and by staggering them and using both funding options, we were able to sustain it for long term. And the quality of care, the most important part was the coordination of care, integrating information technologies into the healthcare industry, reduced a lot of costs and provide a better overall quality of care. The stakeholders' reactions, most of the stakeholders were very positive. They would be huge fans of these initiatives. There's decreased inequity, lower hospital readmission rates, and increased health care. But there would be two people who are conflicted. David Doctor, while there is a significant increase in the PCP income, the average specialist income decreases. And the unmet demand for preventive chronic care spikes, but then it gradually decreases over time, and significantly underneath the baseline. The Harry Hospital, with our initiatives, there's an initial decrease in the profit margins, but over time it'll steady out. So here's our graphs. The blue graph in the middle, that's where we staggered differently our initiatives. We started something a little bit later, a little bit earlier, so see what would happen. And it turns out that it helped with the operating margin. It took a little bit longer for the dip to occur, and so the hospital as a nonprofit, they would have enough time to brace for this new policy change instead of initial really fast response. And then the fraction of preventive care spikes, and by hurrying the start time, we're able to decrease that somewhat. However, that decreased the scores and the rest of the initiatives and the rest of the constraints, like costs, and it didn't work as well. And so you can see from the scores, there's a significant decrease in the overall scoring. And so we decided to stay with our original one, where there would be that initial, where Harry and David would not be so happy with our initiatives. And our trade-offs would be to consider pilots or payments in lieu of taxes on nonprofits, and hospitals to help with their profit margins, and to appease the specialists to get them on board with our initiatives, using loan forgiveness as an incentive for them to be on board, say, hey, we're going to increase your income some, but we'll also decrease your expenditure some. And because of our initiatives, we had so much leftover excess money. It was $1.6 billion of extra money in the fund. And so that means we could incorporate any number of hospital efficiency initiatives. Our implementation challenges, again, would be that the specialists would probably initially oppose it unless we gave them good trade-offs and good incentives for buying in. There'd also be a possible public opposition to the CGP scheme because public might be resistant to change or might not know enough about it, and they kind of have to be explained, like, hey, this is what's happening, it's going to be good in the long term, so you might be uncomfortable at first, but it'll be better. And then, because this emphasizes a broader and increased coverage over the entire population. Questions and answers? Questions? Yes?
So how can you get one category over 100%? I see one of the categories is 110%. Yeah.
I'm not sure how exactly the simulation counts things, because I don't think it's a percentage. It's just probably tallying different factors. I'm not sure how the simulation does it. So.
Yeah, we're not sure how that number came about on the simulation. But in terms of productivity, we feel like the reasoning behind that is, generally speaking, that healthier population equals healthier workforce and less lost productivity due to illness and injury, and therefore increases productivity in the region. And in addition, when you're increasing pathways to advantage, you're increasing economic advantage, economic standing for students, for families. So therefore they are able to, they're earning more, and the overall economic earnings, economic productivity for the region is going to increase. So we feel like that's why that score went up. I can't answer why it's over 100. I don't know enough about the simulator to know that, but that's why we feel like it's a high score for this strategy.
Any other questions?
Okay, thank you very much.